Hi everyone, welcome to Center of Balance Life. I'm Phua from Center of Balance, the acupuncturist. Now, today our topic is how to prevent back pain. How to prevent back pain. And then we're going to talk about the risk factors for back pain. So we've got two topics today, right? So we're going to cover the risk factor of back pain as well. If you have more time. Okay. Hi, Veronica. How are you? Thank you. I'm good. Thank you. Good morning. Good morning. Good morning. Now, if you're on this live video, you're watching this live video, please say hello to me and give me a thumbs up. Give me a thumbs up. Thank you. And what else? If you're on Facebook or Instagram, please a thumbs up. Please share this video, share this live video to others, to your friends, your family, and your colleagues, and tag your friends in. Tag your friend into this live video. Right. Every morning in New Zealand time, at 7, today a bit late, playing something. So 7 or 7:30 or 7:15, and we're gonna start our live video. Right. Let's start. I think that's good. Good to hear that you're good. It's Wednesday now. It's pretty quick. I was busy in the clinic yesterday. Right. So let's start. Right. So how to prevent back pain? We know that one of the causes of back pain is lifting heavy, right? Lifting heavy. And when you have pain in your back, or if you have chronic back pain, so a lot of people have chronic back pain, right? But the pain is not at the level that actually stopping you doing anything, right? So these people, they are not actually going to any treatment. Right, hang on. This is, I think maybe, no. Okay, because one of my Instagram is still going. I can't, it's stuck in there, jamming there. I couldn't do anything for it. I just forgot about that. So I have two Instagram accounts, and sometimes with the iPad, it actually stopped in there. I don't know why. When you share, and it just jumped in there, and I couldn't process. And so today, one of my Instagram is not actually doing the job. But okay, yeah. Let's get back to so lifting heavy is one of the cause of the back pain is the muscle strain thing, right? So you hurt a muscle, the muscle damage. So and the cause of it actually is when people lift heavy, you know. And some people, they do have back pain, but the back pain is not on the level that actually stopping or slowing down things. You know, they just feel it and they can't carry on with life. With those patients, I would suggest that you want to prevent the back pain get worse, or if you had a back pain on a recovery journey and you don't want to get back pain again, don't want to hurt again. So it's important to know that you have, when you carry, you know, life is busy and a lot of people have to carry things. You have to carry less things or less heavy things. So like heavy briefcases, laptop bags, you know, it can be heavy. Yeah, it can be heavy if you put a lot of things in it. Suitcases and or shopping. You know, shopping, when you go shopping, you know, all this bag, in be able to put less thing on it. So because you don't want to add unnecessary stress and strain to your neck and your spine. You don't want to do that. Okay. Then one other things that is majority of people that they get lack of the muscle of we call core muscle, the tummy muscle here. Yeah. The muscle in and around your abdomen and back actually help you keep you upright and carry you through your physical activities. So when you like sleeping in position and get up, when you get up, you're actually using the tummy muscle as well as the back muscle to pull you up. Do you know that? Okay. So people think that, wow, I have back pain, and they just say, oh, my back is weak. Not necessarily just back though. You have back pain, majority of the time, most of the case, they have weak core muscle as well. The muscle in the abdomen are weak too. You know why is that? Again, in Chinese medicine, according to Chinese medicine, the spleen and stomach control the muscles, the entire body muscles. Okay. Then, if your stomach and spleen are weak, then this muscle will be weak, and this muscle will be weak too. Okay. If this muscle weak, and you try to get up, and if this muscle hasn't got strength, it keep pulling you up, and it got hurt easily. Okay, it got hurt easily on the back muscle. Think about this. If I don't know whether you have diarrhea or not. If you have experience of diarrhea, okay, if you have experience of diarrhea, you diarrhea a lot, you feel weak, and even though when you walk, you feel weak, you feel heavy. You don't have enough strength to hold your entire body upright. Does it make sense to you? So think about it. If some people they have diarrhea daily, 1 or 2 times, you won't feel weak like you have 10 times diarrhea. Right? You don't have that feeling the entire body weak. But this diarrhea 1 or 2 times daily, good enough to loosen up the muscle in your tummy, in your back muscle. And that is the root of the reason that cause, the root of the cause that actually cause your back pain. It causes the core muscle. So, of course, now with muscle strength, we can train it. We can train. Hi, Karin. How are you? From Scotland. Thank you for joining us. Thank you. Hi, Hassan. Thank you for joining us. Hi, Happy Day. Thank you for joining us. All right. Now, I know, yeah. If you go to physiotherapy, they all with back pain. I know, think about it with the patient. So I learned this from my patient, to be honest. Because I don't see physiotherapy, I don't learn physio things, okay? And they went to physiotherapists, and they came back and they say, well, physio thing told them they have weak core muscle. The core muscle is weak, the tummy muscle is weak. So set some exercise for them to train the core muscle. I said, this is right, this is good. I said, this is good. And this is the best way to learn from the physiotherapists. So you ask your patient, what exercise exactly that physiotherapy show you, and can you show me how to do that? So your patient show me how to do that, but you find it, oh, is that easy? Exercise is easy. The physio exercise is easy, but yeah, the main thing is how they diagnose. Diagnose always, every exercise, everything that treatments is, and it's about the diagnosis. Diagnosis is very important, very important. Okay, then we can see we see that what a lot of patients that some patients they get better with exercise, the core muscle exercise. The back pain better, definitely. Physiotherapy is good method, good method. Okay, exercise good method, strength good method. Okay, now but some you wonder why some people better but the others not better. They do the same issue, and I assume that the physiotherapy diagnosis of the weak core muscle is right. They got a right diagnose, but how come the same exercise that work for some people but not working for some people? Then you have to come to the Chinese medicine's theory. You ask them about the stomach and spleen questions, disorder question. So, like I say, diarrhea, bloating, stomach pain, worry a lot, anxiety, emotional energy as well, and constipation, bloating, burping. If any of this signs that appear, that with the patient that if they work out with the core muscle exercise training every day and they still get back pain and not seem to be healed, then you need, as an acupuncturist, you need to ask the stomach and spleen function. Okay, so if you're a patient, you need to ask yourself about this. Why aren't I get better? If you have all this stomach and spleen function issues, then that means you need to get your stomach and spleen function better first. Then, therefore, the core muscle exercise will work better. This is what I do. Okay, no matter who come, they've seen they have seen physiotherapy. Okay, and they have been working with core muscle exercise, and that's great. I said keep going, and then I will ask them, do you get better from your back? If they say no, then I ask further about the stomach and spleen function. This is number one. Thank you, Veronica. So this is number one thing. So further on, not just stomach and spleen, you want to ask about the sleeping as well, the stress level as well. All these organs function. If they've been doing the core muscle exercise and they haven't been recovered properly yet, or it's very slow, then ask the organs function questions, all organs, and deal with the organs function. So this is the strategy. It's very important. Once you get to the other symptom, it doesn't seem to be linked to back pain, according to the Western medicine or physiotherapy or chiropractor. But in Chinese medicine, it makes sense. So not until you bring the sleeping better, bowel motion better, emotional better, then they feel, oh, now it's working. The core muscle exercise working. Okay. So be open-minded and go step by step. Ask all the organs questions. If you know pose, use pose. If you know tongue, you look at the tongue and to tell your patient what's going on, and to treat the organs rather than just treating back pain. Okay. Then advise your patient how to prevent it. Not just working on the core muscle. The core muscle is good. Focus on the core muscle, fitness, and routine, and train it is very, very good. But treat the organs. Okay. Yeah, if patient have core muscle problem, exercise, get them to train daily. Okay. Now we talk about when you sit, when you're standing, you need to maintain the posture. The posture means you have to maintain the spine, the curve. Okay, the lower back is like this, uh, thoracic, cervical. Okay, all this thing you need to maintain this. So to improve your posture, it's rather important. It's rather important. Okay, a poor posture can put unnecessary pressure and strain on the spine. Right, over time, this can lead to pain and damage. So regularly remind yourself to roll back your shoulder and sit upright in the chair. I'm talking to you right now. What am I doing? I'm going forward. My shoulders going like this. Then I have to remind myself, hey, come back here. This is a sitting upright position. So sitting upright is very difficult for now of us, because we all in front of the screen a lot, computer a lot. So now this day is more new issues, but a bit different with the old day, right? So keeping your back straight again, when you sit down and you bend backward and to the extreme and you come back a little bit, and the tummy go in a little bit, and open your chest like this, and your neck will be tucked your chin in to the extreme, and then relax a little bit. This is how it's supposed to be, okay? And I sometimes get my patient to roll a towel and put it on the seat, and then put the. Let me show you. Let me show you what I mean. Okay. Let me fix it. Okay. This is what I mean. So you can roll a towel. If there's a towel, you want to keep this, right? You want to keep this, right? Keep the curve in here, right? Keep the C over here. You can roll a towel. So you sit, when you sit, if you can sit right up like this, not actually lay on the chair, so you sit like this. This is the position that you should go to. But this is going to be difficult for people. Why is that? Because if you have weak muscle, then you find, oh, I can't sit properly. You keep naturally go down. Naturally go down. So one of the best thing is sit, put your bum into back of the chair, so you can actually land on the chair. But that's not good enough, because a lot of chair hasn't got, it's all flat in the back. It can't support here, right? So what happens is roll a towel and put it in the lower back and sit like this. Then you find the towel's actually hanging over here, and it helps you to sit right up. It reminds you something's tapped into the lower back. So it reminds you, and what you're gonna do is just try to bring this up and bring this type of chin in and put it out like this. That's it. That's something that you should show your patient, or if you're a patient, you have lower back pain, it's something that you should work on. So always put your bum closer to the back of the chair. You get a roll or a towel, roll it, and put it underneath, and that helps. especially if you drive. Your car, in your car is very important, because sitting in the driving, normally it causes back pain. That is because you haven't got this, you know. Because driving, I've seen a lot of people. My brother, when they drive, they do this. They drive like this. It's a very bad position. When I went back to Malaysia, I look at my brother and they drive like this. It's okay. That's dangerous. It's not good for them to drive. This position is very poor posture. Okay. Now let's see. And because they drive that way, they get back pain, but not necessarily. I always think, why didn't they get back pain? They do. It's a matter of time. My big brother just contacted me last week and said his friend, okay, we played together with his friend when we were little, and got back pain, very bad back pain, and the spine is crooked, is not an alignment. They get an X-ray, and he asked me, with a friend in Malaysia that can refer his friend to get acupuncture and get treatment. He said he couldn't sleep and couldn't sit properly. And when I think about it, okay, this is one of the reasons. When I went back to Malaysia and I, meet them and they take me to somewhere, and when I look at them, how they sit down and drive and the poor posture, you could imagine, because I always sit right up and drive. I said, how it seems comfortable when they drive. It's like they're sleeping. It's like watching TV or things like that. It's very bad. And I said, well, I always question, I want to get back pain because this is actually not on my mind. It shouldn't do that. You get back pain for that. But they don't. They didn't get back pain. But now I understand, since the last week call, my brother called me and asked me about this, and I referred to one of a very good student acupuncturist in Malaysia. And I said, okay, yeah, now I know. It's a matter of time. It will get back pain one day, but not now. Not now. Probably not now. Okay. So yeah, keeping your posture right up is very important. Okay. And okay, the other issues is change shoes. Why change shoes? For women, high heel is not good for you. High heel is very bad for your back, for your spine. Okay, because when we're standing flat, and high heel is trying to push this going up. This going up, what happened? Your pelvic is all changed. Your pelvic is all changed. When the pelvic change, all the spine alignment change, and that's how you get back pain. But I do tell you what, too flat, it causes problem too. So we don't know. Some people, they have to wear high heel, because our patient told me that, well, it's out of my mind, to be honest. I don't know in here. So some patient told me that they can't wear flat shoe. When they have high heel, they're good. The back pain is good. So they keep going. I said, well, keep going with high heel then. Listen to your body. Obviously, it's been out of balance, but it's only high heel that could help them. Then go for it. So the patient tell you what happened. When the patient tests it out, I agree with them. I don't say, no, that's not good. High heel is not good. You should go flat shoes. No. Patient already tested out. He said, well, every time I put shoes flat, hurt my back. And high heel help. I said, go for it. Go for high heel. Simple as. Does it make sense to you? Okay. Now I recently had a patient who last week came twice already. Back pain. He said, every winter I get back pain. When it's raining, I get back pain. When it's cold, I get back pain. Then when it's cold, you get back pain. It works. It stopped his working because couldn't bear the pain. Yeah, stop and go back home. Go home. And what helps? Hot shower or warm shower, a hot bath. When you out of hot bath, no pain. You see, winter get back pain. Raining day get back pain. When it's cold, you get back pain. When happen hot bath, get rid of the pain. What does it tell you? It's to do with the blood circulation, it's to do with the temperature, right? And this patient, I give him herbs because he has diabetes and high blood pressure as well, and high cholesterol. So all this. So I told him that I can help with those things, and I can lower down the medication, and eventually stop the medication. And he was keen of those things, treating others, because he got a lot of side effect from drugs, and he told him that to his he now has dizziness, he now has tightness of the chest, and he actually went back to the doctor, and the doctor said, "Well, keep taking it." It's so funny, isn't it? Some doctors really didn't care about those side effects, but some do. Some do, though. I have patients that the GP keep trying other drugs for them, try to get rid of minimize the side effect, which is a good doctor. We should do that. But some just say, well, keep taking it. That's the only thing we can do. That's very sad. Now, this patient have he keep his leg by accident. It's about 1.5 centimeters different. The left leg is shorter than the right leg. Okay, and he actually get back pain every day. Then what happened is, when it's winter, it was cold, it got even worse. So I used GE acupuncture to test out there two very major imbalance in there. One is rotation, one is short leg and long leg. I tried with one by one, and both work for him very well. Okay, so that means that the structure that's causing the pain for him. So I told him, the first thing first. Now we get rid of pain straight away. That's good, but the pain, I expect the pain come back. Definitely, it'll come back. I said, well, we know that the treatment help you, but the main thing is, how do we prevent it? So already there's 1.5 cm shorter than the other side because the accident is cut off one of the leg on the left side. So you have to go to a specialist to make your shoes taller on one side, so you work even. So this is the thing. If your patient have one side shorter than the other side, like this one, if think about, because of this patient, the bone actually chop off 1.5 cm, then doesn't matter how GE can help with the structure thing, it won't get this patient grow 1.5 length of the bone, right? So what is the best thing? Get a shoes that one side put out on 1.5. Okay, you can't just put something on the other shoes and make it taller, with the other side taller. Now, you need to get a proper practitioner and to measure it, and to measure the foot, because he got all the surgery on the foot and it's wonky now. One side is terrible, you can see it, all scar, and it's not actually on the proper structure of the leg. So he walked like this. Every step he walked like this, stringing side to side. So he need a specialist to look at the special shoes for him. I said, you have to do that. You have to do that. Okay, because that will help you. Once we get rid of the pain, that'll help you prevent the pain. That's one of them, because we test it out. When I do the structural short leg and long legs imbalance, it helped with pain a lot. Get rid of the pain straight away. I got the video. I'll show you another day. Okay, right? So stretching often. I have patients who have lower back pain 20 years. every morning stiff. He had actually hernia this. Okay, no surgery. He found that yoga, half an hour every morning, helped to get rid of the pain. So he got very stiffness in the morning, every morning, stiffness in the back. Practice yoga for the last 20 years. Every morning, stiffness. Oh, no pain, just stiffness. Yoga half an hour, then it's fine. Good for the rest of the day. So that means that the stretching actually helps to prevent back pain. Think about it, in the last 20 years, if he didn't do stretching every morning, yoga, he would end up with a lot of pain. He was coming to me not because of the back pain, because of other issues. And he told me that he put out, yes, back pain in the morning, but actually back stiffness, not actually pain. So he shared with me in the last 20 years, he did yoga every morning, half an hour, never get back pain. So if you know you have back pain, if you find out something that is helping, keep going. Keep going. That is the best thing for your back pain, to prevent it. And he never had. He's sitting in the office. He walk every day. And the rest of the day is good. So we learn from patient. If this patient can stick 20 years every morning for yoga, so we encourage our patient, if you're a back pain patient, you need to find out what actually help your back pain. If you figure it out, you do it every day. If that can prevent your back get worse, then you do it every day. You see what I mean? So this is very, very important. This is very important. Okay. Right. That's it for today. Any question of you? Right. Does it make sense to you? So this is when it comes to prevention of back pain. All those things that just we listed out step by step, and everyone talk about this, but the things that in there is I learned from my patient. Right, yoga, half an hour every morning, and my patient, the experience of my patient, valuable, and I share it here with you. So when it comes to any other disease, when we gonna go through those topics, and every time when it comes to that, if I have any experience in my treatment with my patient, and my patient share with me, and I would like to share with you too. The high heel, who would think high heel would treat back pain, prevent back pain? No, but one of my patients really told me that high heel help with back pain. As soon as she on high heel, no pain. So I said, okay, keep high heel then. She's working every day. And that recent one, that patient, we don't just try to get patient treatment. Yes, it works for acupuncture. Would you tell the patient keep coming weekly for acupuncture? No, the first thing is get the other side, the other leg even, same as the other side. So because that that's gonna help. So refer your patient to others to do this, and that may just help the back pain, prevent the back pain. We don't know, but at least we know we can see the difference, the imbalance. We need to suggest the patient to do that. Okay. Well, does that make sense to you? Okay. Now, if it is, please give me a thumbs up and tell me how you feel about this live video. Okay. Then of course, eating well, sleeping well, all these things, it can help back pain and de-stress. Like managing the stress, it definitely helps back pain. Okay. So when it comes to prevention, we need to know one thing. Prevention is always more powerful than treatment. No matter what disease you treat, you always need to talk to your patient about prevention. You need to figure it out what's going on, what patient can do, what patient can't do, what make it worse, don't do it. Prevention is always more powerful than treatment. Okay, keep in mind that. Okay, I'll see you tomorrow. We didn't have time to talk about the risk factor of back pain, but we'll put it another time. Okay, stay awesome, and I love you all. See you. Bye bye.